All right, welcome everyone. Thank you so much for being here today and welcome to
Salam
our
alaikum.
new Olive members. If you can go ahead and mute yourselves at this time, and when questions come up, please go ahead and put them in the chat for our speaker, and when she gives time towards the end, that would be fine as well. So today's session is about Medicare overview. I would like to thank our friends from Sahara, Bilal, Sarah, and Alicia, who are present here, for bringing this presentation to us and connecting us with our speaker from today, who is Esmeralda Leon from the Center of Healthcare Rights. A little introduction about Esmeralda. She joined the Center for Healthcare Rights in 2019 as an education and outreach specialist. In addition to doing community presentations on various Medicare-related topics, Esmeralda is a registered state health insurance assistance program counselor. As a counselor, Esmeralda works one-on-one with Medicare beneficiaries, answering questions and helping them better understand their healthcare coverage so they can make well-informed decisions. Welcome, Esmeralda.
Thank you. I'm really happy to join you all today, and thank you for joining me to learn more about Medicare. So let's go ahead and get started. Share my screen. All right. So today we're going to talk about Medicare and the different components about Medicare. A little bit about Center for Healthcare Rights. We're also known as CHCR. We're a nonprofit advocacy organization, and we provide free education and help with Medicare and other health insurance for Medicare beneficiaries in Los Angeles County. Funding for our services is provided by the California Department of Aging Health Insurance Counseling and Advocacy Program. If you've ever heard of HICAP or SHIP, that's actually our program. Where Center for Healthcare Rights is a local HICAP in LA County. Every county in Los Angeles has their own program where they can get Medicare counseling. If you have questions about your coverage, or you feel like after this presentation you want to know more, you can schedule an appointment to talk with one of our counselors. You can do that by calling 800-824-0780, and you'll be scheduled with one of us. So you can ask your questions or get more information about a specific issue that you might be having. You can also visit our website at www.healthcarerights.org, and we actually have some educational materials on our website that you can access for free. So today we're going to discuss Medicare eligibility, enrollment periods, and benefits. We'll talk about Medicare costs during this year, and we'll also talk about options that you have for supplementing your Medicare coverage. And then we'll end with a couple of financial assistance programs that can help you lower Medicare costs. Let's start with what is Medicare. So Medicare is a federal health insurance program. It provides health benefits to people who are age 65 and older, and also to people who are under the age of 65 and have a permanent disability. Medicare eligibility is not based on income or resources. So that's different from a state program like Medi-Cal, where eligibility is based on income and resources. And Medicare has three main components. We have Part A. Part A covers hospitalizations. If you need home health care, it would be covered under Part A. So that might be if you need physical therapy in the home, speech therapy in the home, things like that, that's covered under Part A. If you need to have a stay in a skilled nursing facility, and then if you ever do need hospice care, that would be covered under Part A. Then we have Part B. Part B essentially covers outpatient services. So your doctor's visits, if you need to take an ambulance trip, lab work, x-rays, diagnostic tests. If you ever do need durable medical equipment in your home, it would be covered under Part B. And examples of that include walkers. That would be considered a durable medical device. Part B also covers preventive care, outpatient therapy, and mental health services. So outpatient therapy would also include something like physical therapy, speech therapy. And just one thing to note about Part B is that we've put here doctor services, because sometimes when you're admitted to the hospital, some services you receive by the doctor, the physician there, may be covered under Part B. So it can be a little bit confusing, but essentially Part B might cover outpatient, your doctor's visits, and sometimes it might cover some of your hospital services. And then we have Part D. Part D covers prescription drugs. So anything that you need to get filled at a pharmacy would be covered, or not everything is covered, but Part D covers prescription drugs that need to be picked up at the pharmacy. Some of the preventive benefits under Medicare Part B include the Welcome to Medicare exam. When you're new to Medicare, during that first year, you can have an exam. You just call your doctor's office and tell them that you want your Welcome to Medicare exam. It has to take place within the first 12 months of when you start your Medicare Part B benefits. And then Medicare also covers the yearly wellness visit. Physical exams are not covered under Medicare. And so when scheduling an appointment, you're actually scheduling the wellness visit. So they just do, you might bring up any concerns that you have to your doctor. The doctor may refer you to certain lab work if it's needed. So it's a little bit different from a physical. You want to make sure that you don't schedule a physical exam, because then it won't be covered under Medicare. Medicare also covers free annual mammograms for women age 40 and over. Pap smears and pelvic exams are covered once every 2 years. Colorectal cancer screenings for persons age 50 or older. You can get a flu shot each year. It's fully covered. And actually for the flu shot, the way it's defined is per season. So it's actually, because there are different seasons of the flu shot, but it's fully covered when you do get it. And then more recently, we've had the COVID-19 vaccine. This is fully covered too, as a preventive benefit. Now, who is eligible for this? So people who are 65 or older, and they are entitled to Social Security retirement benefits. If that person is not entitled to Social Security retirement benefits, they can also qualify through a spouse or former spouse. So if you're currently married and your husband or wife has eligibility for the retirement benefits, then you are able to enroll into Medicare using their eligibility. You can call Social Security, and you would have to provide your spouse's Social Security number so that they can verify that they are eligible. One of the requirements for this is that the person has to be at least 62 years old if you're applying using their eligibility. If you were formerly married to someone who has eligibility for retirement benefits, you need to have been married to them at least 10 years. And at the time that you're applying to use their eligibility, you need to be single. You cannot have remarried and try to use the former spouse's benefits. And then we have people who are under the age of 65 and they have a permanent disability. These are people who have received Social Security disability insurance for 24 consecutive months. So on the 25th month, a person would start their Medicare coverage. And then we have people who have...
Isha, this is Aruna from Sahara, trying to reach out to you for this week's meeting.
Can everyone
in up to 5 minutes.
mute
Please attend
themselves?
your call.
Or let me see if I can mute everyone. Okay, so I'll keep going, but if you're not on mute, please make sure you mute yourself. People who are under the age of 65 and have a permanent disability, or people who have amyotrophic lateral sclerosis, ALS, or also known as Lou Gehrig's disease, or if they have end-stage renal disease, would qualify for Medicare. And the reason why these are two separate things, SSDI benefits and then ALS and ESRD, is because they have different wait periods. For SSDI, it's after 24 months. For amyotrophic lateral sclerosis, there is really no wait period. And then for end-stage renal disease, it varies a little bit when someone gets their Medicare coverage. Okay. So how do you apply for Medicare when you've reached that age of eligibility? People who are receiving their Social Security retirement benefits, if they've enrolled before the age of 65, will be automatically enrolled into Medicare A and B on their 65th birthday. Or they're going to be enrolled before, and then they'll start the coverage the month of their birthday. So some people get their Medicare cards in the mail and 3 months before. Sometimes I've heard people get them 4 months before. So once you're getting close to that 65th birthday, you might get it in the mail. People who apply for Social Security retirement at age 65 will also usually apply for Medicare at the same time. Right now, because you can't really go to the office to do the application over the phone, they might ask you if you're calling to apply for your retirement benefits, they'll ask you if you're applying for Medicare too. Online, if you go to the Social Security website, you have the option of applying for both your retirement benefits and Medicare, or just applying for Medicare. And that would be Medicare Part A and B. People who delay their application for Social Security retirement benefits until the age 66 or 67 are still eligible for Medicare at age 65. So we have people who don't want to get their retirement benefits just yet. And so they're not sure if they can enroll in Medicare. And the answer is yes, you can just enroll in Medicare and delay enrollment into the retirement benefits. You can contact Social Security at 1-800-772-1213. You can also go to the website, socialsecurity.gov. Another website that actually leads to the Social Security website is ssa.gov. So it's SSA for Social Security Administration.gov. And so again, right now, the offices have not fully opened yet. Right now, they've started taking or seeing some people by appointment if they feel like they need to get things from the person. So they might schedule like a 5-minute appointment with someone at an office. But right now, the best way to contact them is to call them or to go online and apply. You can also look up the local office on the Social Security website, and you can contact your local office, and that's usually the office that will manage your application and process it. We have 3 main enrollment periods for Medicare. The first is the initial enrollment period. It begins 3 months before the month of a person's 65th birthday, and it ends 3 months after. So it's a 7-month period. And this is the best time to enroll into Medicare if you have not been automatically enrolled. It's the time when you can make decisions about the coverage that you want, and we'll talk more about coverage. If you don't enroll into Medicare Part B if you don't enroll into Medicare Part B during this time, the only other time you can enroll is during the general enrollment period. This is from January through March of every year. And when you enroll into Medicare Part B during this time, the benefits will start July 1st. So for people who enrolled this year into Part B between January and March, then their benefits just started at the beginning of this month. For people who are not eligible for premium-free Part A, their only time to enroll outside of the initial enrollment period is during the general enrollment period. And we'll talk a little bit more about premium-free and then premium-free Part A and then Part A with a premium. Then we have special enrollment periods. These are some major life events that may qualify you for a special enrollment period, meaning that you have a certain amount of time to enroll. So for example, for Part B of Medicare, if you delayed enrollment into Part B because you were employed and you had employer coverage, depending on the situation, you may be eligible for an 8-month enrollment period. And we're also going to talk a little bit about that, get a little bit more into it. So do I have to apply for Medicare if I am working and have employer insurance? So for people who are age 65, if they're working and covered by an employer health plan, they do not have to enroll in Medicare Part B. They can delay their enrollment until they or their spouse retires, and they will not be charged a penalty for late enrollment. So this rule only applies if the employer has 20 or more employees. If they have under 20 employees, they do need to enroll into Medicare Part B. And I just want to highlight here that if you're covered because you're working or because your spouse is working, you can delay enrollment. People under the age of 65 who have a disability can delay their enrollment in Part B with no penalty for late enrollment if the employer has 100 or more employees. So it's a little bit different. If it's under 100 employees, then they do need to enroll into Part B. So how does Medicare work with my employer insurance? Typically, if someone is covered by an employer health plan from current work and he or she enrolls in Medicare, the employer plan will be primary and Medicare secondary. So this is, again, if your employer has over 20 or more employees. If you're 65, if you're under 65, it has to be 100 or more. And so when someone has an employer who has under 20 or under 100, it's the other way around. Medicare would be primary and the employer would be secondary. So that makes a huge difference. If someone has Medicare and a retiree health plan from a former employer, then Medicare is typically primary and the retiree plan is secondary. Now, let's get into the premiums. So for Medicare Part A, we have two different types of enrollees. We have automatic enrollees, and these are the people who are eligible for retirement benefits. The reason why we say it's for people who are eligible for retirement benefits is it essentially means that they've worked and paid Social Security taxes for at least 10 years, which is known as the equivalent of 40 work quarters. So they can enroll into Medicare Part A at any time after they've reached eligibility. They don't have to have a special enrollment period. There is no monthly premium for the Part A coverage. Now, we also have the voluntary enrollees. These are people who do not have the 40 work quarters required. And so if they enroll into Medicare Part A, they'll have a monthly premium. If they have fewer than 30 work quarters, then they're going to have a monthly premium of $471 per month. if they've worked between 30 to 39 work quarters, then the premium would be $259 per month. And so for voluntary enrollees, that initial enrollment period is actually very important because, again, for people who are not eligible for the free Part A or the premium free Part A, the only other time they can enroll is during the general election period. And if they delay the enrollment, they actually will be charged a late enrollment penalty. So automatic enrollees pay 10% of the premium for every full 12-month period they could have had Part A coverage but did not. And so this penalty lasts for twice the number of years the person did not have Part A coverage. So let's say they went 2 full years without the Part A coverage, then they're going to have a penalty for 4 years. That would be how it works. Then again, so Medicare Part A covers hospitalizations and skilled nursing facility stays. There's a first day deductible for hospitalizations, and that's $1,484, and that covers days 1 through 60. If a person stays in the hospital from day 61 through 90, there's a daily copay of $371. And then lifetime reserve days are 91 through 150, and the daily copay is $742 per day. And so with Part A, the benefit period refers to, so let me figure out the best way to explain it. So let's say you go into the hospital for 5 days and you've paid you're charged the $1,484 first day deductible. Then you're discharged from the hospital after those 5 days. And you don't need to go back in for 60 consecutive days. And then let's say 65 days later, you have to go back in, you're readmitted, then you are charged the first day deductible again. So it would be the $1,484. Now, if you were admitted to the hospital for 5 days, and then maybe 2 weeks later, so 14 days later, you have to be readmitted into the hospital, then the days that you spend in the hospital after you're readmitted keep counting up. So you stayed 5 days, let's say you stay another 5 days. So it's going to total 10 days that you've stayed in the hospital. And so it's the same benefit period. So after you've been discharged from the hospital and you have not been readmitted for 60 consecutive days, then your benefit period ends. For skilled nursing facilities, the benefit period works in the same way, but the days 1 through 20 are covered in full. And then if you have to stay at a skilled nursing facility for days 21 through 100, then the daily copay is $185.50 per day. Now moving on to Medicare Part B premiums. The standard monthly premium is $148.50, and that's the standard premium that everyone starts off with. But for people who are considered high income earners, they are charged an additional amount that's based on their income from 2 years prior. So if they filed as a single person and the income was above $88,000 per year, they would likely be charged an additional amount on top of the standard premium. If they filed jointly and the income was above $176,000 per year, then they would also be charged an additional fee on top of the $148.50. And so again, this would be for 2 years prior. So if someone's applying in this year and if they're applying this year, then they would be looking at 2019 to see how much they earned. A lot of things have changed for people in the last year. So if there's been a significant life event where the income decreases significantly, there is a way to ask for a reconsideration of that extra fee. And so for Part B, there are also penalties for late enrollment. The difference is that this is a lifetime penalty. It does not go away. So it is 10% of the premium for every full 12-month period. You could have had Part B coverage, but did not have it. For Medicare Part B, there is an annual deductible. This year it's $203. And typically people will be charged 20%. It's a 20% co-insurance. So if you go to the doctor's visit, the Medicare will pay 80% and then you'll be responsible for 20%. And then there's 15% excess charges for most unassigned claims. Basically, what that's referring to is the fact that Medicare has certain amounts that they'll pay for services, and some doctors agree to pay those amounts. And there are those doctors that agree to pay the Medicare approved amount, it's known as accepting assignment. There are doctors who choose not to charge the Medicare approved amounts, and so they can actually only charge up to 15% more than the Medicare approved amount. And that's what you're seeing here, the 15% excess charges. Now, let's talk a little bit about Part D. You have two options in how you receive your Part D coverage. And so the first is through Original Medicare, and then you enroll into a plan that only covers the prescription drugs. And then we have Medicare Advantage plans. Some people refer to this as Part C of Medicare. So C as in cat. It's not a mandatory thing. It's only an option that you have in how you receive your coverage. And Medicare Advantage plans typically cover Parts A, B, and D. With prescription drug plans, these plans contract with Medicare to provide the Part D benefits. You would keep using your original Medicare for Parts A and B services. So this card that you see on the screen under Original Medicare, you would continue using that card. You would be able to use any providers that contract with Medicare. You will not need referrals or prior authorizations for hospitalizations and medical services. One of the things that you may want to consider is how you would want to supplement Medicare. When you're going to keep Original Medicare and you decide that you're going to get a prescription drug plan, there are a few things you want to consider. So which plans cover all of the prescription medications at the lowest price? So consider the monthly premium, the annual deductible, co-payments. You want to consider whether there are any rules, like whether you'll need prior authorization for a certain medication, if there are quantity limits or step therapy, meaning that, before you're approved to take a certain drug, you have to go through you have to try other prescriptions before you get to the actual prescription that you need. Is there a preferred is your preferred pharmacy in network? So some people prefer CVS, Walgreens, some people like Costco. So you want to make sure that the pharmacy that you go to is within that plan's network. And next, we also have the Medicare Advantage plans. So these plans contract with Medicare to provide all Medicare Part A, B, and D benefits. When someone enrolls into a Medicare Advantage plan, they assign their Medicare benefits to the plan, and they work with their primary care doctor to manage their medical care. All specialty services must be authorized by the plan's medical group. And patients can use out-of-plan providers only in emergency and urgent care situations. Some people do prefer Medicare Advantage plans because they generally have lower co-payments when compared to Original Medicare. They're considered to be cheaper than buying a Medicare supplement, also known as Medigap. And Medicare Advantage plans are able to provide additional benefits that are not covered under Original Medicare. So over-the-counter drug benefits, some dental coverage, transportation to medical appointments, vision coverage, sometimes gym memberships. People, some people want those extra benefits in their coverage. And so they choose to enroll into a Medicare Advantage plan. When considering Medicare Advantage plans, you want to consider which plans contract with the doctors and hospitals you want to see. And if you have original Medicare right now and you're thinking about enrolling into a Medicare Advantage plan, you want to make sure that you talk to the doctor's office, maybe the billing department, to find out if they would still be able to see you. That's really important to always consider. Or even if you're changing from one Medicare Advantage plan to another Medicare Advantage plan, you want to make sure that your doctor will remain in network. So those are really important things to consider. Another thing you want to consider is how much you'll have to pay for office visits, hospital care, or specialty services. Will all your prescription drugs be covered? How much will they cost? And then what other benefits does the plan offer? So vision, dental, transportation, those are all things that that may be offered by a plan. And the Medicare.gov website actually has a helpful plan finder tool where you can compare Medicare Advantage plans, or you can compare prescription drug plans. Now, for Part D, do I have to enroll in a Part D plan? So enrollment is voluntary. If you have drug coverage that is equal to or better than the standard Medicare drug benefit, you do not have to enroll into a Medicare drug plan. This is what they call creditable coverage. And so if you have employer coverage, when you've reached eligibility for Medicare, you want to make sure that you find out if your drug coverage is creditable coverage. If it's not, then you would want to enroll into a Part D plan. And then once you reach Medicare eligibility, you're supposed to get an annual notice from the plan letting you know whether or not you actually have creditable coverage. If you have no drug coverage, there is a lifetime penalty for late enrollment. The penalty is 1% of the base premium for each uncovered month. So this year, the national base premium is $33.06. It changes every year, so it would be 1% of that. So again, technically enrollment is voluntary, but if you don't enroll and you don't have creditable coverage, then you're risking getting a lifetime late enrollment penalty later on. So for Part D, when can someone enroll? There's the initial enrollment period. That's the 7-month-long enrollment period when someone reaches Medicare eligibility. So 3 months before the month of eligibility and 3 months late after the month of eligibility. Then we also have the annual election period. It's widely known as open enrollment. It takes place every year between October 15 and December 7. You can choose a new Part D plan or a Medicare Advantage plan. And then all benefits would be effective January 1st. So if you don't have Part D and you want to enroll, usually this is the only time when you can enroll into a Part D plan. Or if you do have Part D coverage, it's the time of the year when you can make changes to your coverage. And again, we have special enrollment periods for Part D. And the person can change their drug plan outside of a regular enrollment period in certain situations. So some examples include loss of employer-based drug coverage, if you move out of the Part D plan service area. So if you're moving to a different county, there is no guarantee that the plan that you have will cover you in the new location. If you enter or leave a nursing home, that's another opportunity to change your drug coverage. And then we also have the extra help special enrollment periods. And we'll be talking about this in a little bit. So under Part D, there is an annual deductible, or there can be one. It can range from $0 to $445. the amount the plans can set for the annual deductible is capped at $445. It can't be more than that. And there are different coverage periods. So we have the initial coverage period. This starts after the deductible is met. And so you may pay up to 25% of the total cost of your prescription drugs. If your drug costs equal $4,130, then at that point you may move into the coverage gap. It's been widely known as the donut hole. It's technically not really a hole anymore. There technically isn't supposed to be a gap. You'll notice that you'll still pay 25% of the cost for a brand name drug and 25% of the cost of the generic drug. And so until 2020, there was no cap on how much a person would be responsible for. So it could be above 25%. Now the plans can't make a beneficiary pay more than 25%. And so that's why I said that it's technically closed. But still people do see an increase sometimes in how much they're paying for the prescriptions, because in the initial coverage period, they may actually be paying less than 25%. But in the coverage gap, if the costs equal $10,048.39, then at that point you move into the catastrophic coverage phase. And so at this point, the person would $3.70 or between $3.70 up to $9.20, or 5% of the cost for each prescription drug. Now let's talk a little bit about the gaps in Medicare coverage. So there are various costs with Medicare. Under Part A and B, you have premiums, co-payments, deductibles that need to be met. For Part D, again, there are premiums, co-payments, and deductibles. And there are certain things that are not covered by Medicare. We have dental care, routine podiatry, eyeglasses, hearing aids, incontinence supplies, transportation to medical services, custodial nursing home, or personal care services. So those are not covered under original Medicare. And again, that's another reason why someone might want a Medicare Advantage plan, because they may get some of these services. But you have other options too. So under original Medicare, if you would prefer to keep original Medicare, there are two different options that you can consider. And so we're looking at step 3. Ways of supplementing Medicare could include Medi-Cal. So it's the state health insurance program for low-income Californians. It provides dental, vision, and long-term nursing home services. It also includes things like hearing aid coverage and transportation services to medical appointments. And then we also have the Medicare supplement, which is the Medigap. So it's a Medigap plan is a private insurance policy. They help pay for Part A and B co-payments. And we'll talk a little bit more about that. And again, we have the Medicare Advantage option in which people can enroll into a Medicare Advantage HMO or a PPO. In LA County, all except one of the Medicare Advantage plans are HMOs. And so again, you can get the added benefits like dental and vision services. And there's a possibility that you'll have lowered co-payments for the services that you receive. So Medicare Supplement Insurance, Medigap, again, it's a private insurance plan. It covers some or all of original Medicare's co-payments and deductibles. They must meet specific state and federal requirements and are standardized. Each plan must contain a package of benefits that match one of 10 plans labeled A through N. So there are 10 plans. They can get confusing because they're called, they are plan A, B, D, and so each plan has, each A plan is the same, each B plan is the same. The difference is in how much they're going to help you cover those A and B costs. Part A and B costs. Some Medicaps have foreign travel benefits, and they cover medical care received outside the US. In California, Medigap insurance is regulated by the California Department of Insurance. So if you actually want to see some sample rates on how much a Medigap might cost, you can go to www.insurance.ca.gov. When can I enroll in a Medigap plan? So generally you have a 6-month open enrollment period when you first get Medicare Part A and B. During this time, you have a guaranteed issue rate to enroll into a Medigap. You cannot be denied due to a pre-existing medical condition. Medigap policies can require a 6-month waiting period for pre-existing health conditions though. And federal and California laws provide additional guaranteed access based on specific qualifying events. So it technically, they're like special enrollment periods where you may be able to enroll into a Medigap. And we have Medi-Cal. If you receive Social Security supplemental income, then you are automatically qualified for Medi-Cal and you'll be enrolled. If you don't receive SSI, then you can receive Medi-Cal if you meet the income and resource guidelines. So for a single person, the income limit is $1,482. And for a married couple, the income limit is $2,004. And that's the gross monthly income limit. And then the resources, which include, they won't count the house you live in if you own it. They won't count one car. If you have a second car, that will count as a resource. They'll also look at money in bank accounts, stocks and bonds, other property. And so the resource limit for a single person is $2,000. For a married couple, it's $3,000. And so when someone has Medicare and Medi-Cal, then Medicare would be the primary insurance and Medi-Cal the secondary insurance. Medi-Cal would pay the Part B premium, the $148.50. If you have a late enrollment penalty, it would be waived for both B and D. You would automatically qualify for extra help. And then if you have Medicare and full Medi-Cal, you cannot be billed for the Part A and B co-payments or deductibles. So we talked about the original Medicare 20% copay under Part B. Then if you have Medi-Cal, Medi-Cal will cover that 20% copayment. And federal and state laws prohibit Medicare providers from billing a person with Medicare and full Medi-Cal. This is called balance billing. So if you have a situation where you are being billed and you have these two programs, you can give us a call if you need some help figuring out what's going on. And so I'll go over a couple of the programs that are available. If you maybe don't qualify for Medi-Cal, you don't want Medi-Cal, we have the Medicare savings programs. These provide financial assistance with the Medicare premiums. In order to be eligible for this program, you have to be enrolled in Medicare Parts A and B. You can apply on the DPSS website, Department of Public Social Services. If you want assistance with this program, our counselors can help you with the application and we can actually submit it for you. There are 3 programs under the Medicare Savings Program. We have the QMB, which has the lowest gross monthly income limit. For a single person, it's $1,074. For a married couple, it's $1,437. And this program is kind of special because it would pay for both the Medicare Part A and B premiums. So if someone does not qualify for Part A without the premium, they can apply for this program. And, if they're approved, then they wouldn't have to pay that Part A premium. And then in addition to that, when someone is approved for this program, the state pays for the Medicare deductibles and co-insurance. We have the specified low-income Medicare beneficiary program and the qualified individual programs. These 2 programs pay for the Part B premium only. And for a single person under SLMB, the income limit is $1,288, and then for a married couple, $1,700. $1,442. For the qualified individual, the income limit is $1,449 for a single person and $1,960 for a married couple. And for all these three programs, the resource limit is the same. So for a single person, that's $7,970, and for a married couple, $11,960. And if you have any questions about this, I'm happy to answer. I know I'm kind of speeding through it. I want to leave time for questions. And just very quickly, I want to remind people to always be very careful. People with Medicare are regularly targeted for scams. So make sure that you don't respond to offers for free medical equipment or services, because it could be, you could later down the line get a bill for something like that. Check your medical statements regularly. If you notice something there that for a service that you didn't receive, that's a sign that something could be wrong. Be careful with insurance agents pressuring you to switch plans. It happens a lot of the time. People have original Medicare and they're told that they have to enroll into a Medicare Advantage. Again, you do not need to enroll into a Medicare Advantage plan. Some of the things agents can't do includes conducting marketing or sales activities and at an educational event like this one. They cannot approach people in public common areas or sell door to door. They can't just show up at your house out of nowhere. They cannot state that they are calling on behalf of Medicare. They cannot make unsolicited phone calls for potential enrollees, and they cannot provide information that is inaccurate or misleading. So keep those things in mind. I know that they're constantly doing these cold calls where they are calling out of nowhere. I would recommend not talking to them, but some people do choose to talk to the agent. So if anything, make sure that you get their name and, if possible, get their license number. Because then if something goes wrong, then you'll have that information so that it can be reported. And that's something that we also do. We can report when there's been misrepresentation of coverage that you're signing up for. And one program I forgot to talk about, the Extra Help program, also known as the Low Income Subsidy. There's two levels of help with the Low Income Subsidy. You can qualify, again, through Medi-Cal, and you can qualify through the Medicare Savings Program. You can also qualify through the Social Security website. And this is what I'm showing on my screen now. For the full Extra Help, the benefits include a $0 deductible for prescription drug plans, co-payments of up to $3.70 for generics, up to $9.20 for brand name drugs. And if your costs reach $6,550, then Medicare would pay 100% of the costs. The partial subsidy would lower the annual deductible to $92. You would pay 15% of the drug cost, and if your costs reach $6,550, then you would pay no more than $3 for generic drugs and no more than $9.20 for brand name drugs. If you have questions about these programs, go ahead and give us a call. If you're not sure if you might qualify, you can schedule an appointment with a counselor and we'll go ahead and review that with you. The Extra Help or Low Income Subsidy Program through Social Security, you can apply online. You can also call Social Security and ask for an application. If you would prefer to apply online, but you are not comfortable doing it on your own, you can talk to one of our counselors, and it's something that we also help with. Right, and so again, if you want to talk to a counselor, you can call 1-800-824-0780. And so if anyone has any questions, or if there's anything, I know I kind of skipped through the low income subsidy, I can go a little bit more into detail for that. Right. And so
does anybody have questions for Esmeralda? This is a good time. You can unmute yourself.
That we saw sound far away again.
Oh, I'm sorry. Is this better?
Kinda.
Hello, Esmerella.
Hi.
Thank you very much for your presentation. Is it possible we can get a copy of that, if possible?
Yeah, so I can email it.
You can go ahead and email it to me and I can share it. I wanted to remind everyone, we do have our YouTube page and this session was recorded and we will have it available to you in the next few days. So
Oh, please send me that in so I can start looking.
Yeah.
I didn't know we had a YouTube page.
Well, yeah, we do. Any other questions?
This is just for LA County, right? What about the Orange County?
So every county has a high cap. And unfortunately, I do not have, there's one number that you can call and it's for the region. And so they'll route you over to the Orange County high cap. Yeah, sorry, I don't have that number with me right now.
Okay, if you can send it to Zena.
So each county is different? Each county has different, like
Yeah.
Riverside County?
Yes, so every county would have their own version of the high cap program. So yeah, I'll send that phone number over so that if you need to contact a different county, they'll connect you with that county's high cap.
Thank you.
But for the most part, I believe that it should be pretty much the same because it is a federal. Is that true?
So the information about Medicare it is a federal program. As far as the high caps, I'm referring to counseling services for Medicare. That's a different organization or agency that provides the counseling services. But yes, this information is applicable to different areas.
Perfect. Thank you.
Yeah.
Any other questions? Right. Okay. Well, thank you, Esmeralda. It was definitely something that was very beneficial and something we will all have to learn about one day or the other, be it for our parents, our family members, and our elders in the community, because this does apply to so many we know. Thank you again, Bilal, and all our Sahara friends for bringing this presentation. You're welcome.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.